Hi, this is Happiness Guy. Welcome to today's episode of Vestibular Talks. Today's special guest is Susan, also known in Instagram as Migraine Scholar Canada. She's sharing her personal journey as a migraine patient, and she's developing a community where she can raise awareness about chronic illnesses, more specifically about migraines and vestibular migraines. She's also a PhD student. She's doing social work, and she's trying to make sure that migraines deserve the attention and the proper knowledge that they deserve to have, because many people underestimate migraines as just a headache. But in her page in Instagram, she makes sure that people understand the complexity of a migraine illness. All right, so remember to like, share, and subscribe. Enjoy the episode, guys. Find your happiness. Susan, how are you today?
I'm good. How are you?
Great. Welcome to this episode of Vestibular Talks, and thank you for taking the time to join us.
No problem.
Would you mind telling us a little bit about who you are and your story?
Yeah, that's a big question. So I am a chronic migraine patient. I have vestibular migraine, which is also turned into other types of migraines over the years. I've had these for about 17 years chronically.
Oh,
Yeah, so in addition to that, I am back working. I am a social service worker, and I'm also doing my PhD research right now on migraine care in Ontario, Canada. So my experience as a patient really made me motivated to figure out how can we improve the system for migraine patients, how can we make things better, why are people being misdiagnosed, and how can we treat them better and get their needs met more effectively.
that's amazing. You have a lot going on in your plate, so it's congrats. I mean, it's pretty impressive to see someone that, although is struggling with a very difficult condition or a set of conditions, is also working hard, going to school, and doing all these things. So that's very. I admire you for that. That's great.
Thank
Uh,
you.
Susan, do you mind telling us? Okay, so you mentioned you suffer from chronic migraines. You also mentioned vestibular migraines and other
Mhm.
types. Most often than not, people understand migraines are, oh, it's just a headache. So you often see people that say, oh yeah, I get headaches too, I get migraines. Would you mind telling us in your own words how migraines affect you and what they are?
Yeah, so maybe I should just start at the beginning a little bit.
Please, sure.
So when I was in my mid 20s, I started to get these really weird attacks that would come on where I would get vertigo and I would get ringing in the ears. I would feel very strange. I would sometimes get visual aura. I didn't know the term for it at the time. And it happened infrequently. Like there was one year I might have had two attacks happen, and then they started to get more frequent until one day I was at work and I had a horrible attack where I was doing some work at my desk and the words started to kind of float off the screen. I felt extremely dizzy. And so I managed to tell my boss, and a coworker drove me home, and the dizziness just didn't go away all weekend long. I was bedridden and I felt nauseous and terrible, but I didn't have a headache. Um, and so the following Monday, I ended up going to my doctor and I explained what was going on. And he said, oh, you probably just have a virus, and said, take Gravol, you'll feel better, it'll go away, and sent me on my way. And from that point on, for about a year and a half, I was misdiagnosed as having inner ear disorders. So they told me I had Meniere's disease after that because my symptoms didn't go away, but the diagnosis never fit. And I was also having a lot of neurological issues in addition to the dizziness, but no one was paying attention to that. So I was having visual aura. I was having feelings of depersonalization. I was getting headaches sometimes that I know now are migraine headaches. But at the time, I thought I'm stressed out and dizzy. So it's just a headache because I'm so stressed out and dizzy. So for me, vestibular migraine wasn't really treated as migraine at all. And I had a lot of uncertainty as to what was going on with me because I didn't have the typical migraine headache that people have.
And often your story is very powerful because it basically describes the journey of many people, like the fact that you went to the doctor and they diagnosed you with eating disorders is quite common. They often say, oh, it's Meniere's disease, or you have labyrinthitis, or vestibular neuritis, or things like that. But they don't seem to pinpoint it to vestibular migraines. So how do you eventually get to that diagnosis? Was it through testing, through your own research? Like, how do you figure it out?
Yeah, so I did a lot of my own research because I went through a few different doctors and an ENT and an allergist, and they kept just passing me off to different people, but all along the lines of this has to do with your inner ear or sinuses. No one ever said migraine, but I started to do a lot of reading because, like I said, I would mention the more neurological symptoms like the visual aura, and no one paid attention to me. No one paid attention to the symptom. So I said, okay, I'm going to go on the internet and figure out what's going on. I joined a Meniere's group on Facebook at the time, and other people's experiences weren't matching up with mine. So there was a lot of talking to other people and doing my own research. And finally, I got to a point where I started reading up on silent migraine because vestibular migraine wasn't really talked about a lot in 2006. There was a little bit of information out about it, but not very much. But silent migraine was talked about a little bit more. And so I started to understand, okay, I can have these symptoms and I don't necessarily have to have a headache associated with it.
Yes.
And so I asked specifically to see a neurologist at that point, about a year and a half or so in. And so I was just basically looking for validation. But I knew at that point what was wrong with me. I had researched treatments. Like I had a straight line of what I wanted to do at that point. But I needed a doctor to say, yeah, you're right. Yeah.
And you're right, because the neurological symptoms are so debilitating and hard to explain to someone that is not living them. For example, with me, I started with everything I looked at seemed like everything was vibrating or floating. Things would look like they will, like if I look at the picture that is behind you, it will almost look like it was floating on the air. It wouldn't look solid into the wall. So it scared me because I'm like, what is happening to my eyes? So I originally believed that there was something wrong with my eyes. Also, the fact that you feel like you're off kilter, like things seem tilted to me at the beginning, almost like in a 45-degree to the right. So when I try to explain that to doctors, we don't get it. Like, how is that possible? We don't understand. So the fact that you're on, hey, it's a kitty. So there is the fact that you did your own research and you didn't just settle for what other doctors were telling you or that they were passing you around from one to another. That you became your best advocate, because if you wouldn't have pursued it that way, they probably would have wrote you off as like, oh, it's Meniere's, it's an inner ear condition. So kudos for being so proactive and doing your own research. Now, what kind of treatment did they pursue after you saw the neurologist?
Yeah, so they gave me topiramate first, which actually worked really well, but I started to have some serious side effects.
Okay.
So I went off of the topiramate. We decided that wasn't right for me. And then I went on amitriptyline, which I have a love-hate relationship with, because it does help. It takes my symptoms down, but it does cause side effects. In the past, I gained a lot of weight. I've actually lost 100 pounds since going off of it years ago, and then I started going on it again, but I've learned to manage my weight on it a bit better. and I'm not on as high a dose, which also helps.
Okay.
I also get Botox now,
Mm-hmm.
and I've been doing that, I think, for about 8 years. So I get Botox injections in my head and my temples and my neck and my shoulders. And I take a bunch of supplements. So, I mean, we tried different things along the years because, like I said, the amitriptyline I've kind of always gone back to.
Mm-hmm.
Triptans never really worked for me as abortives. The beta blockers never really worked for me at all. So I had a really hard time finding things that worked for me. And like I said, the only thing that kind of works has its own trade-offs.
Mm-hmm.
So now my migraines are actually acting up a bit more.
Oh.
And so my choices to look at now are the new anti-CGRP drugs, potentially, which I need to do more research on in relation to vestibular migraine, because I haven't heard a lot of vestibular migraine patients talk about taking it. Or nerve blocks is something I haven't explored yet, where they do an occipital nerve block in the back. So that could be helpful, I'm not sure, but that's kind of been my journey in terms of medication. But aside from that, I found lifestyle changes has made the biggest impact. So diet, exercise, avoiding food triggers, of which I have a long laundry list. Addressing those things, making sure I go to sleep at a decent time, getting up at the same time every day, staying on routine, having a schedule. Yeah.
The medications, yes. So Topamax, it seems to help a lot of people, but you're right. The consensus is that it gives them a lot of side effects for some reason.
Yeah.
So a lot of people come off of it fairly quickly. And then the go-tos are usually amitriptyline, nortriptyline, which is what I'm on right now, nortriptyline.
Mhm.
And a lot of people seem to be taking Effexor. And Effexor seems to be working for a lot of people, but I talked to my neurologist, and he's completely against it. He says no, it doesn't work. You don't see any benefits. So, anyways, what I'm getting at is that we are all so unique. We're diagnosed with the same condition. However, not all the medication is not a one fits everyone. It's like depending on our own bodies, chemistry, I guess, how we react to some medication and to others. You mentioned that you were in a high dosage of amitriptyline, and I noticed that in a lot of people, doctors tend to prescribe high dosages, which could be counterproductive, because you're right, we're already so sensitive as it is, that when they give us high doses of medication, the side effects seem to be quite strong, and it kind of like deters you from, hey, I don't know if I want to be on the medication anymore because it's giving me all these side effects. So I'm kind of glad that you went down on the dosage of amitriptyline, but I'm sorry to hear, like I am really sorry to hear that the symptoms are getting a little bit worse as the years go by, because you hope that with medication, as you take it for long periods of time, hopefully the symptoms decrease and become more manageable. So I'm very interested on the fact that it seems to for you, they have actually evolved to a more increased level as the years go by. So what do you do in that case? Like you're taking the amitriptyline at a lower dosage. Are you wanting to also maybe try to pump it up a bit, or are you trying to just live with the symptoms as it is?
Honestly, I've never been a fan of these medications. And I mean, I guess my reasoning as someone who also works with a lot of people who have experienced mental health issues and within a healthcare facility that operated from a medical model, medications are commonly prescribed. These medications are commonly prescribed for anxiety and depression, and then off-label uses such as migraine and other neurological issues. The issue I have is they know what they do, but they don't know everything that they're doing. So for example, when I took topiramate, I only had vestibular migraines, pretty much. I had the occasional headache migraine, but for the most part, they were vestibular. I went on topiramate for about a month and came off of it. I had to taper off of it. And I don't know if it changed my brain or what it did, but since then, I've had other types of migraines. I've had more commonly headache migraines that I never got those first year and a half, 2 years. I do get the more common like migraine with aura and then the headache. And then I also get more, I don't know if they're completely hemiplegic migraines, but I do get like the paralysis on the one side. I've had other symptoms like aphasia and trouble speaking. I never had those problems until after I came off the topiramate. So that could be a coincidence. I don't know, but it's always made me a little wary of medication. And like I said, I've been with amitriptyline for many years. I was on it for quite a few years at a higher dose. I went off of it and I noticed, again, things changing, like I developed more anxiety. I started to have panic attacks more often. I felt like something was going on with my brain chemistry that was not the way I felt before. I never struggled with those issues as much before. So I think there's always a trade-off. And I'm not saying don't take medication, because obviously we're all trying to get help in different ways. But for me, I've actually gone the opposite route, where I'm trying to focus more on, how do I get my diet under control? So the past week, I've cut out sugar. I've decided I'm going to get really clean and really get rid of trigger foods and go for a month and see how I feel, and evaluate that. Getting back into an exercise routine. And I've actually had really good results with just doing those lifestyle things in the past, but I have to be regimented about it.
Consistent, yeah.
Yeah.
It's very hard because, for example, I'm extremely, to the point that it's almost obsessive, is extreme in my diet. Like I basically just eat grass and water. It's ridiculous, and it's I believe it's helped me, but it hasn't cured me. And at points, it makes me miserable because I see my family and my friends having meals of what they want to eat. Like they want to have a hamburger, they want to have pizza. And in my mind, I'm like, nope, nope, don't even look at it, don't smell it, nope, don't, no, no. So it's so hard that we have to already deal with these debilitating symptoms. And on top of that, there is not a, you're right, like there is not a list that says this pizza is gonna make you sick. It depends on who you are, right? So it's so difficult for you to know your exact triggers. So I forbid myself from basically everything, and it's I'm surviving, but I'm not really living, as you say. You enjoy life, like you don't, because you're constantly watching what you eat, careful with what you eat, careful what you put in your mouth. So it's I don't know, like when people ask me, oh, is the diet working for you? Yes, but I'm not, like, you're not happy with it. Like you kind of adapt to it, and you kind of like, well, I guess this is my life now. But I want to tell people, you know what? Don't trade your happiness for that. Like if you know, like if you struggle with symptoms and stuff, try to avoid big triggers like red wine, coffee, things like that. But if you want to eat a piece of brownie or a muffin, you know what? Like eat it. I should take that my own advice, but I just tell people don't become as obsessive as I have, because I limit myself so much from diet. But I get what you're saying, and yes, the lifestyle changes definitely do help. Now, Susan, obviously these conditions are so newish and unique and hard to explain. How do you explain to your loved ones, or to, like, whether you were in a relationship, to your partner or to your friends and to your family, when this first started happening, all the crazy symptoms, because they don't make sense?
No, that's been hard, and it's still hard. So my partner and I actually had just got married within weeks when this happened. So we had been married 2 weeks, and then I started getting these horrible attacks. So we started off our marriage with a chronic issue that couldn't be defined in our mid-20s. And that's just not how you start off a marriage. It's not fun, and we've managed to kind of get through it. It's been this long. but it's been hard. It's been hard expressing what's actually happening. And I think over time, there are times when your friends and your partner and whoever's in your life, like they just get sick and tired of hearing about it. So people I found were really sympathetic at first, but they don't have to live with it, right? I do. So after a while, they have the luxury of wanting to shut it out, but I can't shut it out.
Yeah.
And so that's become a source of conflict in some relationships in the past. There are certainly people in my life who I stay away from when I'm going through a bad cycle and I'm having a lot of symptoms, unfortunately. And then I have some really good people in my life who they completely understand. Like I can text them or call them and be like, I'm spinning and I'm freaking out and the room is moving around me. Please talk me down. And they have and they will. So I think it's really important to identify, especially in those early times, like who are the people who got your back, who are the ones who are going to stick by in the long run, because this is a long-term thing. It's not going to go away.
You're right.
Unfortunately, you have to learn how to deal with it. I mean, I hope for some people it does go away, but in my case and many other people's cases, it's something you have to manage for the rest of your life.
And I'm unfortunate, but I like your honesty and your realism, because it kind of upsets me a bit when I see people online that are like, oh, I got better, and now if you want me to help you get better, I'm gonna charge you for your time. And I'm like, I find that a little bit sketchy, because you're like, no, like if you really got better and you know the struggle that this is, I mean, everybody has to make a living, I get it. But I feel like some people are monetizing and banking on the idea that they got better. And maybe they did get better, but is it a temporary better? Is it a permanent better? Like did the condition kind of like went dormant and we wake up again in a few years? So when they kind of promote, oh, I got better and I know the ways to get cured and pay me if you want the secret, I'm like, I don't know, like that just doesn't go right with me, because if I'm getting better, but if I get completely better, I'll just start telling everyone, hey, this is what I did, this is what I took, and hey, maybe you'll get better too.
Yeah.
Susan, what about being in such a high-paced life, like being a professional, going to school for your PhD, being a wife, having pets? How do you manage to function when symptoms are high? Like, are you able to tell people at school or at work, hey, like I'm not feeling good, or you kind of just put up a strong, brave face, a smile on, and just go on?
That's been hard. So I would say that for the first 10 years or so that this was happening, I tried to hide it. So I worked in a facility that was a drug and alcohol rehab.
Okay.
And so it was a very fast-paced job. It was a very stressful job. I was a program counselor. So I was bouncing between doing one-on-one sessions and group sessions, like therapeutic sessions, and teaching classes, and basically running the components of the treatment program with a few other people. And so I didn't want clients to see me in distress. I had an obligation professionally and ethically to be a certain way, and my job is very important to me. So I just got used to it. And you don't ever really get used to it, but I taught myself how to appear okay when the room is spinning. I taught myself how to appear okay when I'm getting those visual symptoms, like you said, when you're walking and things are bouncing up and down, or when you start to get visual aura. I taught myself to kind of hold it together for chunks of time to get me through a one-on-one session or teaching a class. I've given presentations in situations where I'm not well, but I've managed to get through, and people have told me that they didn't see anything wrong. So obviously I was doing something right, but I don't do that so much now. I have started to be more honest about what my needs are, because I burnt myself out. Like, you can't do that forever because you get exhausted. My body was exhausted. My mind was exhausted. So I took a break from working for a while and I went back to school. I did my master's. And when I did my master's, I was really honest with them about, I have these migraines and this is what happens. And my master's degree was actually in gender studies and feminist research. And the faculty was so inclusive and so wonderful. Like even the director of the program, I remember meeting with her about accommodations for classes. And I remember her saying, if you get an attack, tell me, and maybe we can arrange how you can get a drive home. And everybody was just really lovely. And so now my PhD is in the same school, and I'm with the social work faculty. And again, like everyone is very inclusive. The school is really great about accommodations for people with disabilities. I haven't really had to use many accommodations, especially working from home. It's made it easier. So I've been fortunate that things haven't been so bad, but at the same time, I know who I can reach out to. I know how I can problem solve and that they're open to problem solving in regards to my work. So that makes me feel a lot less pressure than back in the day when I was working for a nonprofit and I had all of this pressure and I had to be perfect all the time. That was the message I was getting. I don't feel that now, especially like I run my own practice. So I'm in charge of my time. I'm in charge of how I meet with clients and how that goes about. So that takes that pressure down too.
Okay, that's great.
Yeah.
The purpose of videos like this interview between you and me is to raise awareness, because of people that are suffering with the same or similar conditions and similar symptoms often get misdiagnosed by like, oh, you're just an anxious person, or you have depression, or you have bipolar disorder, when in reality they have a very real condition. Well, I'm not saying the other conditions are not real. I'm saying this is a condition that affects all of your nervous system. Like it affects how you see, how you think, how you react. So the purpose of this type of vestibular talks is to raise awareness. That being said, I noticed in your Instagram page, you're very honest with how you raising awareness, and you're very honest in the way how you speak, and you say that when you're going through an attack, when you're going through an actual headache. Have you found any backlash from people bothering you about posting these things, or have you found mostly support from people saying, "Oh, thank you for doing this, thank you for being so honest"?
I think it's mostly been supportive. So I just decided 3 weeks ago to start that Instagram page because I wanted a space that was specifically for my research and that was migraine related. And at first it was just going to be about research that I'm doing and awareness of other research going on in Canada, because there's not many people doing migraine research. So I wanted to draw attention to it. But then I was like, my experience is not separated from my research. So I'm just going to put it all out there and see what happens. And for the most part, aside from dodging a few people who want to sell me cures, for the most part, it's been really, really good. So I'm thankful. I'm hoping that continues, and people are connecting with some of the things that I've posted, which has been really, really nice.
Nice. Susan, what about the fact that in the United States, they have the Vestibular Disorders Association, VIDA, which is great, but Canada doesn't seem to have such support when it comes to vestibular disorders. I have talked to fellow Canadians that it took them years, like in your case, to get a proper diagnosis, because many doctors here in Canada don't really, either they are not aware or they don't really know about how these conditions affect people. So do you think that the awareness that you're raising, myself and a few other people that are Canadians that are trying to gather a group together, do you think we'll eventually get enough momentum to be more validated by the medical establishment? Or do you feel that in Canada that's always just going to be kind of like laying low type of thing and not get the priority that it deserves?
I hope that we can. So in Canada, yeah, we don't have the resources for migraine even at all that the United States has. There's a doctor in Quebec who's actually started a nonprofit called Migraine Canada. It's only a few years old and they're growing. So they're constantly doing things to raise awareness of all types of migraine. They started a podcast, which I was interviewed for. They're doing webinars. I posted about an upcoming one that's coming up, and I'm going to be doing one in March. So they're going to be open to anybody. They're free. So they're starting to do more awareness and more education. But there isn't a lot. And just the motivating factor for my research is that, like you said, doctors aren't aware. And I think that is a worldwide problem. It happens in the States too, but I'm really looking at what's happening in Canadian care in Ontario, and the type of research that I'm doing is called institutional ethnography. Okay. And so the whole point of it is you go into the system from patient standpoints, and you try to understand what is actually happening. What is the work patients are doing to get a diagnosis? What's the work of the health professionals that are trying to help them? It's very much focused on what are people doing? What are the policies they're following? What are the best practices they're following? And trying to get at and understand where things are going wrong, basically. So I'm hoping from the research that I'll be able to identify there's a policy or a practice or a way that work is being done with patients that needs augmenting, or it needs to be changed in some way. And so that's kind of what I'm exploring with my research. So I'm hoping, in connection with people like Migraine Canada or other patient advocates, that's something that we can use for advocacy.
Okay, that's great. Yeah. To get very successful results, because we do need that level of awareness here in Canada, around the world as well. But Canada, I believe, needs to be more up to par with the reality that many patients are living, because as you know, these conditions are so debilitating that you and me are blessed that we still have the capacity to work and basically fend for ourselves. But I've known many people that they basically have to depend on their family members because they are not able to work, they're not able to get out and get a job or to go to school because the symptoms are so debilitating for them. Susan, something that if we rewind a little bit, earlier in your story, you mentioned that they passed you on from ENT to an allergist to different people. To me, I was passed along to a few different people, but I got to a neurologist fairly quickly. But they are now exploring the fact that maybe allergies trigger these vestibular migraines, or not necessarily that trigger them, but make them worse. What was your experience with the allergies? Were they able to make any connections between the allergies and the symptoms themselves, or not?
Sorry, no, not so much. I feel like at the time it was just the ENT passing me off to someone else because she didn't know what else to do with me, to be quite honest. All that came out of it was I had a dust allergy, which I knew about. And that's kind of where it ended. So that was the interesting thing, that I got passed along to these different doctors and then it just stopped. It was, okay, you don't have any significant allergies. Here's a nasal spray for the dust allergy. And then I was done. And then I had to go back to my family doctor, a few months later and be like, okay, I still have these problems. No one's fixed me. Now what? And that's when I started to get more, advocating for myself and looking into neurological issues and explanations.
Yeah, which is very interesting. Much like you, I also have pets. I have 4 dogs. They are my babies. So I started getting allergies lately, and I went to the doctor. They passed me off to an allergist, and they said you're allergic to dust and to the dry weather. Well, we live in Canada, and it gets really dry during winter, so they gave me a nasal spray, but it hasn't really changed the symptoms. So I said, okay, I'm still going through the same, much like you. And I'm like, what's next? And they're like, nothing really, like basically it was nice to meet you and good luck type of thing. So you're very right, like they kind of start you in a process which gets your hopes up that, hey, maybe this is going to help me, and they reach a point where it's almost like they give up on you and they're like, okay, well, good luck and we wish you best. So you're right, there needs to be a little bit more accountability on their part to not just drop you, but continue. Hey, okay, that didn't work. What else can we explore in order to help you get better? Susan, what would you like to say to the people that are often like, when these conditions first start, when the symptoms first go chronic, we get into a really dark place, like, because you don't know what's happening to your body. Vertigo and dizziness are two things that are extremely debilitating. I don't wish that on anyone. Like, I always tell people, I'm like, if you want to feel like crap, you ever get vertigo or dizziness, is the worst of the worst. Like, you have no control, you have no balance, you feel nauseous, you feel sick. So when this first happened to you, like, what helped you cope and get stronger that you could maybe advise the people that are just starting in their journey to maybe find that, hey, there is hope at the end of that dark tunnel?
Yeah, I think for me, at first, what kind of kept me going was I don't really know what's wrong with me. So they'll figure it out, and then someone will give me something to fix it. And then that didn't pan out. And I didn't really know what was wrong. And over the years, I developed a lot of anxiety, and then I would go into bouts of, lows. I think the biggest thing that's helped me and that I wish I practiced way back when at the beginning was more mindfulness, more stress reduction techniques, knowing that it's okay to take time out for myself, learning to challenge my thoughts that took me to the bad place and that dark place, and to kind of, turn them around and look at the situation a little bit differently. So doing a little bit more CBT with myself. So practicing all of those techniques that, we often do it after we have the anxiety and after we have the depression, but I wish I had done it before it even got to that point, because I think it would have prevented that burnout if I had just slowed down and said, you know what, I need to take care of myself, like you said. Maybe on the weekend, I don't go out and put on a show and pretend I'm okay for everybody else. Maybe I take time to rest, and do some yoga and sleep more. And that's something I've had to learn over the years, but I wish I had it then. So take time for yourself, and don't worry about other people's expectations as much.
Yes. Susan, what does the future hold for you?
Hopefully, I do some really good research. Hopefully it's something that people read and they want to use to motivate for action. Like I said, no one's doing migraine research in Canada, especially migraine research in the social sciences, where they're trying to understand the system or, what's going on with patients. We often hear about research about drugs and neurobiology, and that's great, but there's a lot of that. I think we really need to pay attention to what patients are going through, and what it's like to live with a chronic illness, whether it be migraine or fibromyalgia or endometriosis, all of these contested illnesses that people and even health professionals, don't always believe are happening. I think we just get passed off as being head cases, when the reality is we're really dealing with some really heavy stuff. So I'm hoping to bring more attention to that, and hopefully my career will go in that direction and I can keep doing this type of research because it's what I'm passionate about.
Nice. One, yes, you're right. A lot of doctors pass people off as hypochondriacs. Oh, this is all in your head, you're imagining or you're exaggerating, which is not the case. We know how we feel. We know our bodies better than anybody else.
Exactly.
And the fact that we describe it in such panic state is because that's how we're feeling inside. Like, we're feeling that something is not right. So that really gets me, Susan, when people are like, oh, maybe you're a hypochondriac, maybe you're exaggerating. I'm like, if you knew the type of internal battle that I live every day to just look normal for people, you will be amazing. You'll give me a trophy or a medal, because you have no idea how hard it is to be normal.
Exactly.
The other thing that you mentioned is that you mentioned this earlier, is the fact that you said something earlier on about viruses that you said the word virus. I just can't remember the exact. I don't want to paraphrase what you said, but you said earlier on the word virus, which triggered a light bulb in my head, because some people seem to think that these conditions often get triggered by viral infections, like the Epstein-Barr virus and things like that. In your research, have you came across any kind of connection that would trigger the viruses would trigger migraines or these types of migraines?
No, and like I said, so they thought they were focusing on the vertigo and nothing else. So they thought you have a virus that's triggering vertigo, and that's all it is. It'll go away in 2 weeks. So that's how that kind of came up for me. As for a virus triggering migraine, I don't know about any literature that points to that. I do know that now that I know about migraine, because I never really thought much about migraine either. I thought it was a really bad headache. My mom had migraines when I was a kid, and I didn't really understand what it was. You know, I didn't understand why she carried a bottle of Tylenol 1s and 222s in her purse at all times. I didn't get it. So there was that hereditary factor that I never put 2 and 2 together. Yes. I also realized now that when I was a kid, I actually was probably having abdominal migraines, but I didn't know that at the time. I was that kid who would throw up and, you know, for no reason and feel lousy for 2 hours. And then all of a sudden I was okay. And my parents thought, oh, she has, you know, anxiety. She's just nervous, or she's faking sick to get out of school. And it wasn't. I really think looking back, that's what was probably going on with me. And there were other times in my life where I actually think I was suffering from migraine, but I didn't know it was migraine. So I think doing that kind of, when you know the information, kind of going back in history, even vestibular patients or silent migraine patients, they might find that they have incidents of migraine in their background, in their history, in their family. And it's just manifesting differently at a different time in their life, but they might actually find that they have that history and they didn't even know.
Yeah, I think it was episodic in those times and wasn't chronic like it affects us now, like you and me. So when you have episodes, you don't really make the connection like, oh, this might be connected to a migraine. You're like, oh, maybe I have a bug, maybe I ate something that I wasn't supposed to eat. But you're right, like once you go back in history and start thinking about connecting the dots, then you see a pattern throughout the whole time. Yeah. Susan, something that I should have asked earlier is, you mentioned one of your symptoms was depersonalization, which I felt it a lot when I was first going through this, or dissociation. As you've had many years now going through this, does it get better? Does it get worse? Do you kind of eventually live with it? What happens with that symptom?
I still get it, and it's probably one of my most troubling symptoms. I actually had it today on and off. So, because I'm coming off of like a 3-day migraine, and the headache part went away, but I keep having this feeling where I feel out of sync with my body. And I can't even, I was trying to describe it again to my husband, and he just looks at me like, I have no idea how to reference this feeling. But yeah, it doesn't get any easier. I would say for me, I'm used to the vertigo. I'm used to the headaches. I'm used to the pain. I'm not used to the depersonalization. I'm not used to the visual aura. Like those things still make me panic every time, because I'm like, oh my God, I'm gonna have a stroke. And I know that I'm not having a stroke, but I'm worried, what if this is the time? So it doesn't, because it's so weird. It just feels weird.
It's almost like you're in a dream-like state, and almost like you're seeing your body in a third person. It's like you're not you, but it's like you're automatic. It's extremely strange. I completely get it. And the fact that you mentioned a stroke, we, or us as migraine sufferers, are more prone to strokes. So that your fear is not irrelevant. Your fear could, you're right, like we could at any, because the symptoms are so strange that it could eventually lead to stroke. So yes, we gotta be extra careful with that. Susan, where can people find you if they like to learn more about you, your research, and your page?
Yeah, they can find me on Instagram at Migraine Scholar Canada. That would probably be the best place. Otherwise, I am listed on, sorry, my dog is very intrusive today. I'm at McMaster University in the School of Social Work, and my name is Susan Kate, so anyone can look me up on the School of Social Work's website. and they can see my research bio and my email if they want to send me an email about any questions about my research or talk about anything like that at all.
Okay. Before I get to my last question,
Yes.
would you be open-minded to? I know a few people, patients, and physiotherapists in Ontario that are really good advocates for vestibular migraines and for vestibular symptoms in general. Would you be okay if I pass them along your information so you kind of connect? Yeah. Okay. Awesome.
Yeah, I would love to speak to them. Yeah.
Awesome. And my last question to you, Susan, is, as you know, the channel is called Find Your Chappiness. So it means find your happiness. How does Susan find her chappiness?
Right now, it is enjoying the simple things in life. So just getting back to just enjoying watching a movie, enjoying relationships with other people and the connections that you have, all of those things that we take for granted every day. I think, you know, being sick with migraine and chronic migraine, but also being stuck inside for the past year and dealing with COVID life, it's made me really appreciate all of those little things like going to work, seeing people in the office every day, having those little interactions that you have. So just enjoying mindfully those little things that happen in the everyday and acknowledging them as being important to your life.
Awesome. Thank you very much. And for the credits, before we go, you gotta let me know the name of the dog and the cats.
Oh, yeah. So my dog's name is Winnie, and my cat that was up here was Lucius, and I have another cat named Titus, who are both Siamese.
I see
over there?
They go up and down the stairs. Yeah, I see.
Okay.
Well, hopefully they're gonna be famous too. So yeah.
You never know.
Thank you, Susan. Well, thank you for your time. Really appreciate it. And yes, I'll put you in contact with the people that I know in Ontario. So hopefully we can kind of like I believe we're stronger together, and hopefully they can maybe be of any support in your research if you maybe have some questions for them or vice versa.
Yeah, absolutely. That would be great.
Awesome. Well, have a fantastic day, and thank you so much.
You too. Thank you.
Bye-bye.
Bye.